This video is going to talk to the patients that are having both hip and knee replacement. Both of them carry risks that are inherent within each operation, but there obviously are general risks, and we're going to talk a little bit about that. Um, Please listen to this whole entire video, and it will go over this. First and foremost, surgery is not without risk. Those risks, the biggest risks that we run into with surgery, obviously, are infection that carries for both hip and knee replacement, blood clots, which we try to treat you for. You can fracture after the operation. You can fracture during the operation while we're actually putting in implants. It is rare, but it can occur. Obviously, the issues of bleeding or nerve injury come up. These are also rare events, but they do happen. So in the big scheme of things, these are the things we worry the most about and are all risks that are inherent within the operations of both hip and knee replacement. In addition, for hip replacement surgery, you can have issues with dislocation. It is a very rare event, is getting rarer and rarer in the hip world. And the issue of infection is even more common now than dislocation. And so in my practice, I worry much more about healing and optimizing your healing, which is where we're going to move into the next portion of this informed consent. There are three things that we try to modify before surgery. One, obviously, I cannot modify your age. Your age alone puts you at increased risk. However, I can modify smoking. If you smoke, you have to let us know. We will work with you to get you through that, but we will not operate on people if they are smoking, as this is a modifiable risk factor. So we need to know this. Number two, if you are a diabetic, diabetes, we like to see a tightly controlled situation with your hemoglobin A1C. Most of you know your number. Right now, we are trying to get people with numbers below 7. There are recommendations out there below 8. We will not do surgery on you if your hemoglobin A1C is above 8.0. Our goal is to get people down to approximately 7.4. So that is your goal. You can do it, and it absolutely makes a huge difference with respect to complications after your surgery. The third one is your weight. Weight is not a major risk factor until your BMI starts to climb above 35 and definitely above 40. I do not have an absolute hard stop, meaning for weight, unless your BMI is above 45. If your BMI is above 45, because of the seriousness of the risk factors that go with this, which include wound infection and blood clots, we will not operate on you. However, we will absolutely work with you about getting yourself in a position to succeed for your hip or knee replacement. These obviously are not all of the risk factors. Right now, the ones that we talked about are by far the most common risk factors that you will see. You will, in your packets prior to surgery, approximately 2 weeks before your operation, there will be a packet that comes home that has an informed consent within it. Please read that. If you have questions, please either call the office, address us through the portal. We're happy to answer your questions. These obviously are not all of the informed consent issues, but they are very important for you to understand. Now, the last two really are once the implants are in, there are some things that can happen. They are rare, but they can happen. Number one, in a knee replacement, for the most part, they are cemented. It is a very rare case, but occasionally the cement will not adhere like it is supposed to. This is something that we see probably less than 1 in 500 joints, so it's very, very rare, not something that I typically worry about. Number two, in a knee replacement, you can have component instability. We try very hard during the surgery to make sure this does not happen. However, you can injure ligaments during the rehab or during as you have your knee implant, that can actually happen also. And it is something that may have to undergo additional surgery. Again, a very rare complication. In hip surgery, it is similar. However, most of the hip implants are not cemented, which means that your body has to heal to them. Your bone actually grows into the hip implant. It will grow into the cup and it will grow into the stem. When that happens, it is incredibly important for you to be mindful of not overdoing it when it comes to hip replacement surgery. That means 2 weeks after your operation, you should not be playing golf. You should not be powerlifting. You should not be bench pressing. These types of activities are things that will put your hip at risk. Bone healing takes approximately 8 to 10 weeks for good bone to start to heal to the implant. Soft tissue healing takes approximately 4 to 6 weeks for good healing. The skin, believe it or not, within about 48 to 72 hours is almost waterproof, which is fantastic. We actually put a waterproof dressing on your skin so that in hip surgery, so that it is completely blocked off from the outer environment. This is placed in the operating room and almost in a sterile fashion. So those dressings do not even come off for a week. By the time they come off, most of the wounds are watertight and are very resistant to any sort of infection from the outside. So those are the big risks that come with hip and knee replacement surgery. I really appreciate your attention. It is something that we try not to gloss over. It is the reason why we want, when we entertain doing these operations, they are done because people have pain and dysfunction. And we are more than happy to, again, talk to you more about this. If you have questions on this, either call the office or approach us through the portal on the website. If not, we'll see you in the operating room. Have a wonderful day.